Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home. Otherwise, medically complex clients at home, adults and children, which includes BIPAP, CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, and home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, and we also provide palliative care at home. We have also sent, and we are sending our critical care nurses into the home for emergency department bypass services, and we have done so successfully in the past for the Western Sydney Local Area Health District, their In Touch program. So today I want to answer a question actually from one of our clients that we're currently working with, who has their loved one still in ICU, but is thinking about getting him home. And here is the situation. And the client is saying, I am aware of the risks and dangers of bringing my husband home without ICU nurses, and I've been thinking about it, and I have not signed anything yet as far as the whole thing is concerned. Now, our client's husband is in ICU with a tracheostomy. He's just pulled out his nasogastric tube, and he needs a PICC tube to go home because of his inability to be decannulated, having the tracheostomy removed by now. He's off the ventilator already, but he still has the tracheostomy and the PICC tube. So, and she thinks that the danger has passed to take him home with intensive care nurses. So that's an option that she's considering. And obviously that's something we do here at Intensive Care at Home with 24-hour critical care nurses, because that is what is needed for someone with a tracheostomy and a PICC tube at home. And it's evidence-based as per the mechanical home ventilation guidelines, which are evidence-based. You can look them up on our website, and I have put a link towards it, that someone with a tracheostomy needs critical care nurse 24 hours a day with a minimum of 2 years critical care nursing experience. So they are actually tracheostomy competent. Now, she's also worried that once her husband is at home, that, he needs to start eating and drinking again, even though he will have a PICC tube, and what that would look like. Now, again, if someone has a tracheostomy, the best way to start eating and drinking again is to do some swallowing assessments and some speech exercises with the speech pathologist. The cuff needs to be put down on the tracheostomy to see whether a patient can swallow or not. Now, her husband is also on dialysis because he's in chronic kidney failure, right? And whilst dialysis can be done at home with percutaneous tracheostomy, peritoneal dialysis, it is important that it can be done as an outpatient as well, so that the dialysis center is accessible, and then dialysis can be done as an outpatient, right? So, but that all requires the skills and the expertise of 24-hour intensive care nurses or critical care nurses at home to make that a reality, and in order to be safe at home. Like I've been saying on this blog before, when patients have gone home with a tracheostomy, not even ventilated, without 24-hour intensive care nurses, patients have died. There's enough evidence out there for that. That's why the mechanical home ventilation guidelines exist as the gold standard, right? Anyone who wants to lower standards when it comes to tracheostomy and or ventilation at home is potentially signing off on a death warrant, right? It's almost like a death sentence, right? We've seen it over and over and over again. So it is really highly negligent for anyone who wants to send home a patient with a tracheostomy with general registered nurses without ICU experience, let alone with support workers, or disability support workers. That's, in my mind, that's a crime. And I will stand by everything that what I'm saying here. So it's good that, we're moving one step closer to getting your husband home here. If you're watching this, and I know you do, then, it needs to be with critical care nurses 24 hours a day. And keep in mind, an ICU bed is $5,000 to $6,000 per bed day. and intensive care at home is approximately 50% of that cost. So once again, it's a win-win situation for everyone, including for the funding body who's funding the ICU bed, right? Tracheostomy tubes can be changed at home. Weaning can be done at home. PICC tube changes can be done at home. Dressing changes, but also feeding can be done at home as well, including oral feeding, assuming that a speech therapist is involved with who can do the swallowing exercises. So I think it's all steam ahead here for going home. You know, once the funding and the critical care nurses are in place, we will hire a team of critical care nurses that is suitable for home care. And you will see that your husband will be home in no time, and he will be in very good hands. So with intensive care at home, currently we're operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider in Australia, TAC and WorkSafe in Victoria, NIISQ in Queensland, ICare in New South Wales, DVA all around the country. Our clients have also received funding through public hospitals, private health funds, as well as departments of health. We are employing hundreds of years of intensive care and critical care nursing experience combined in the community. That is unmatched in 2024 in Australia, I believe, and to bring this high level of skill into the community. Now, and if you're at home already in a similar situation where your family member or yourself is ventilated, tracheostomy, you know, and you feel unsafe, or you're wondering whether you would get 24-hour critical care nurses at home, I highly encourage you to reach out to us. We have helped pretty much all of our clients to get the right level of funding, because otherwise we wouldn't be in business, right? We help our clients advocate for what is the right thing for them and what is also safe. You know, we have put stops to ICU readmissions with our service from day one, you know, where ventilated clients at home were bouncing back into ICU, or, you know, others have died who didn't get our service in the early days. You know, you are at high risk if you're at home with a ventilator and a tracheostomy without ICU nurses. Let's be very clear here. Or if you're in a hospital in a similar situation and you want to go home, please reach out to us, right? Now, if you are an NDI support coordinator watching this and you're looking for nursing care for your participants, please reach out to us as well. Or if you're looking for funding for more nursing care, I also encourage you to reach out to us. We can help you with the advocacy, and we also provide level 2, we also provide NDIS nursing assessments. We are also providing our own level 2 and level 3 NDIS support coordination, which is critical for most NDIS participants in those complex situations. We're also providing TAC case management. And if you are a critical care nurse looking for a career change, we're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, in Bendigo in Victoria, as well as in Warragul in Victoria. If you have worked in critical care for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care qualification, we will be delighted to hear from you. Because we are offering a tailor-made solution for our clients, which includes regular staff, our clients want to have the same staff coming over and over again because they are very vulnerable. And it's all about building those critical relationships and having regular and stable teams. So if you are looking for agency work where you can come and go, this may not be the right fit for you because we're looking to engage with you on a long-term basis and our clients want to engage with you on a long-term basis. So it's all about building those critical relationships long-term so that it remains a win-win situation for everyone. And if you are an intensive care specialist or ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in ICU, ED for your long-term patients in particular, or for patients that are coming back over and over again. We are here to help you to take your pressure off your ICU and ED beds. In most cases, you won't even pay for it. And if you're a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, please reach out to us as well. We can help you there. Lastly, if you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately. Once again, contact us at intensivecareathome.com call us on one of the numbers on the top of our website or send us an email to info@intensivecare@home.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and for families with intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my YouTube channel or if you're a subscriber to our email newsletter at intensivecare@home.com. Thank you so much for watching. This is Patrik Hutzel from intensivecare@home.com, and I will talk to you in a few days. Take care for now.